we do see that sometimes with Graves' disease, even though the classic symptom is weight loss, a lot of people do experience weight gain. Some people get exposed to COVID and develop subacute thyroiditis. Some people get exposed to COVID and develop Graves. For all these questions, I wish it was a quick 30-second answer. Sometimes it is, but for a lot of these, it's not as simple. Hey, this is Dr. Eric. And in last week's Q&A episode, I answered many questions related to thyroid health. And in this episode, I'm going to do the same. What is your opinion of Rife frequencies for healing of the thyroid? Is it possible to still experience Graves' symptoms if you still have Graves' antibodies, but your thyroid hormones are within normal range? If so, why does this happen? How might a breastfeeding mother naturally treat hyperthyroidism when one of the most potent antithyroid herbs, Bugleweed, is contraindicated during lactation? It's a good question, and that's the challenge. So let's go ahead and get started with the first question, which is if you have CT scans with radiology contrast solution twice a year, will it cause problems with your thyroid gland? And I mean, most people aren't getting CT scans twice a year, but some people do get CT scans with contrast solution every now and then. And it can be a problem, especially if iodine is used as a contrast agent. So I have spoken about this on the podcast. I have a separate Q&A episode. So you could do a search, and some of it, I believe, is based on some of the research, not just experience from patients, although that even if there was no research, the experience from patients, we can't ignore that. So yeah, like iodine contrast, I would be nervous about. Other types of contrast agents, again, I mean, everything's risk versus benefit. So it might not directly affect the thyroid. Now, could it pose other health issues? Possibly, but I'm sure there's a good reason why you're getting them. So if it's iodine, I'd be cautious. Again, obviously it's up to you. I'm not saying not to get it if it's iodine contrast agent, but if it's a different contrast agent, then again, you just have to weigh the risk versus benefits. So next question, September 2023, I was diagnosed with postpartum hyperthyroid. Fast forward a couple of months and it turned into hypo with the tag of 16. I was on Armor for a year, and suddenly last month my TSH plummeted to 0.017, my T3 and T4 were within range. I had symptoms of headache, chest pain, dizziness, palpitations, tinnitus, and difficulty concentrating. My free T4 is 1.3 and total T3 is 144. Not sure how or why my thyroid flopped. My doctor just wants to continue checking labs every 2 to 4 weeks, even though I'm symptomatic. What would cause the sudden flop? I'm going to have antibodies checked in a couple of days for Graves. I mean, it could definitely be sudden when someone develops hyperthyroidism, whether it's Graves' disease or toxic multinodular goiter. That usually would be more gradual, but someone with Graves or subacute thyroiditis is what I meant to say. That could kind of come on suddenly. Now, Graves, it might seem like it's coming on suddenly, but it takes time for the autoimmune process to develop. And yeah, like what caused the switch? Like if it's subacute thyroiditis, and you'll find out when you have the antibodies checked, but subacute thyroiditis is induced by a virus, but it could have been a virus and like that was already in you, like cytomegalovirus, for example. On the other hand, some people get exposed to COVID and develop subacute thyroiditis. Some people get exposed to COVID and develop Graves. And again, it seems like a very quick process. Even another stressor, not just we're talking about viruses here, but other stressors can be a factor in why someone makes a switch seemingly so quickly. So again, sometimes the honest answer is we don't know. It's sometimes it might be obvious, like someone gets COVID and then they become hyper and we could say it's the COVID. And even in that case, I say, well, that's COVID was probably the straw that broke the camel's back. There were probably other factors, other underlying factors. And so I can't tell you definitely just based on this question here. That's what, again, a health history is for, comprehensive health history, doing some testing in addition to the thyroid. But again, your doctor is not going to look at the cause. So not a surprise that they just want to monitor the labs. That if the antibodies are negative, especially they're going to want to monitor it because if they're suspecting like subacute thyroiditis, you might switch back to hypothyroidism sooner than later. All right, so Tanya with the next question. I have Hashimoto's and I have a question about the safety of prebiotic inulin. I purchased organic chicory root inulin powder after hearing you explain the benefits of prebiotics, and I take 4,700 milligrams in a morning smoothie every day. But I read some studies where inulin caused liver damage, which was in rats, and also that you shouldn't take it long term, only up to 24 weeks. Is inulin risky? Thank you for your help and ongoing advice. Yeah, so I have not seen any problems with patients taking inulin, just taking, again, and I wish I could say, like I take the prebiotic inulin powder, maybe like a teaspoon, which I'm not sure how many milligrams that is. I don't know if that's like if you're following the recommendations, like if someone's taking massive amounts of prebiotic inulin, maybe that would be a problem. But again, it's a prebiotic. It's even that. I mean, not that I'm saying massive amounts is something someone should do, but I'd be more concerned that someone will get a lot of bloating and gas by consuming too many prebiotics. And that happened to me in the past and it wasn't really a massive amount. It was just more than my body was used to at the time. So yeah, I've had a lot of patients take prebiotics. I've been taking prebiotics for a long time. I check my liver enzymes regularly. They're fine. It doesn't seem like it's a problem so I'm not concerned. Everybody's different. And again, you're not a patient, so I can't tell you, yes, just take it. Don't worry about it. But in my patient base, I tell them to take it and not to worry about it. All right. And then next question. I've been euthyroid for a couple of years with high antibodies. Now my antibodies are almost gone, but if I don't take my Bugleweed within a month, I feel like I'm getting hyper with a high resting heart rate and respiratory rate. So do I still have hyperthyroidism? And what's next now? Does the cycle ever end? And that's from Frida. So thanks, Frida. Well, I mean, you said you've been euthyroid, which is normal thyroid hormone levels, for a couple of years with the high antibodies, but the antibodies are gone. But were you ever euthyroid without taking Bugleweed? Did you ever have normal thyroid hormones without taking Bugleweed? Because if that's the case, if you've been taking Bugleweed all along, then I don't know if we'd say, then you can't really say you were euthyroid, because euthyroid to me is like someone who has normal thyroid hormones without taking anything. So if you've been taking Bugleweed all along, and then if you don't take it, and I mean, it sounds like you might, but really the only way to know for sure would be to retest. So I would say if you don't take Bugleweed in a month, you feel like you're getting hyper and a high resting heart rate, maybe before you take it again, do another blood test and see what it looks like. But to me, it sounds like you are hyper. And as far as what's next, I mean, the cycle does end. Typically, when you say the antibodies are almost gone, again, I'm not sure what level are they. Like if someone, and there's different tests will have different ranges, but let's say if someone is doing a test where the range is like between 0 and 0.55 compared to like the one with the percentage, and someone has their antibodies at one point were 10 and now they're 1.5. So they're a lot lower, but they're still above the range. So someone might say they're almost gone. And again, this might not describe you, but I don't know just because I don't have your labs. But if someone's antibodies are now mildly high, they could still develop hyperthyroidism. So really the next step would be to normalize those antibodies if they're still high. So like you said, they're almost gone. Don't necessarily expect them to be 0 in every case, but might need to get lower, especially if they're still elevated. So that's what I would say. I'll also add that some people have antibodies for not only Graves, but Hashimoto's, and sometimes the Hashimoto's antibodies can cause transient hyperthyroidism. So yeah, maybe look at those, not just thyroid stimulating immunoglobulins, but TPO antibodies, thyroglobulin antibodies as well. So next question is about homocysteine. So my homocysteine is elevated at 12.6. And I read in last week's newsletter about homocysteine and your journey. Again, she's talking about my Healthy Gut, Healthy Thyroid newsletter, which you can check out by visiting savemythyroid.com/newsletter. So it stated that for your own personal treatment, you took folate, B12, and vitamin B6. Could you please expand on that? What type did you take? How much and for how long? When did you finally notice your homocysteine was in normal range? And again, this is from Paula. So thanks for your question, Paula. So I forgot how much detail I went in the newsletter, but I have an MTHFR C677T homozygous genetic polymorphism, which is a common genetic variation, and that affects what's called methylation, and that relates to that can cause high homocysteine. So in my case, it's genetic, and I took initially and still do a product Methyl Protect from the company Zymogen. And so you could look at Methyl Protect and see how much of the B6, the B12, I mean, it has mostly the B12 in the form of methylcobalamin, also methylfolate, has something called trimethylglycine, I think 500 milligrams of that. For the other ones, again, I don't know exactly. I forget how much of methylcobalamin might be 1,000 micrograms. But again, look, you can check out the actual bottle. And I took it pretty regularly, like daily. And then I tried taking it every other day, and the homocysteine went up again. But more recently, I've been able to just take it a few times per week, like 2 or 3 times per week, and still keep the homocysteine below 10. Like ideally, like 6 to 9 is where you want to keep it. So I'll just continue every now and then to monitor it. But yeah, that's what some people, if it's not genetic related, then maybe they only need to take it for a few months. But the only way to know is take it for a few months, and then if things look good, and then you could like try to wean off of it and see if it goes back up. So next question from Olga. So I was diagnosed with Graves' disease and still fighting the remaining antibodies. However, I got DNA testing update, which said that I am at high risk of hypothyroidism, not hyperthyroidism. Could this somehow be related? That I am prompt to hypothyroidism, but genes somehow switch to Graves' disease? Or should I anticipate hypothyroidism in the future due to genes? Yeah, I mean, keep in mind, genetics is a factor, but environment and gut health are more important factors. So, I mean, I don't know if I would say I would anticipate hypothyroidism in the future, because if you're doing things to address the cause of the problem, heal the gut, then that should help to prevent you from developing hypothyroidism. Now, why did you develop hyperthyroidism, Graves, if like the genetics don't suggest that? I'm not sure. Again, we don't know everything when it comes to genetics and autoimmunity, including Graves, Hashimoto's. So even with celiac disease, it seems like 95% of people with celiac disease will have one or both of the HLA markers, but 5% won't have that. So does that mean there's not a genetic component for those 5%, or is there genetics, but it just doesn't show up? So again, we're not sure, or maybe if they found out the answer recently, I'm just not aware of it. But again, the body's complex and we don't know everything. So I'm not sure why you have Graves if you don't have genetic markers that suggest so. But again, there's no guarantee you will develop hypothyroidism just because the genetic testing you did suggests that you will. Stephanie says, I have a question pertaining to taking quercetin, 500 milligrams with Hashimoto's. I read somewhere that it could act as a thyroid disruptor. I'm on NP thyroid and was wondering if it's okay to take quercetin with desiccated thyroid. I don't take them at the same time and usually wait for at least 5 hours after taking my NP before taking quercetin. Is it okay to stay on quercetin? Sure, would hate to give it up. Thanks for your feedback, and thank you for everything you do to help the thyroid disease community. You are welcome, Stephanie. Thank you. And I am not aware of any evidence that quercetin disrupts the thyroid. It can act on the immune system, which is not a bad thing. Could be a good thing, and also could help with conditions such as histamine intolerance and all that. So I think it's okay to stay on the quercetin. Again, I say I think just because you're not a patient, and if it was a patient of mine and they were on, I don't recommend quercetin to everybody, but I wouldn't really be concerned. But again, I would just, so especially you take it 5 hours after taking the desiccated. So it shouldn't affect being on NP thyroid itself. But as far as just separately disrupting thyroid, I've not seen any evidence. And even if there's anything out there, it doesn't mean where is it coming from? Is it just on a random blog post? And even if it's in the literature, how strong is the evidence and all that? So I wouldn't be too concerned, but obviously it is something you could monitor and just make sure, if you notice that since you started quercetin, your numbers, your thyroid numbers are more on the hypo side, then maybe you take a break from that and see how you do without it. My guess, it won't cause any problems though. So next question, what can I do to naturally cure the hyperthyroidism? Quick question, but again, it's not a quick answer. I would just say, look into, for free information, the podcast, the podcast, Save My Thyroid, which is what you're listening to now. And then my books. I have 2 books, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, get the 3rd edition, and the Hyperthyroid Healing Diet. So I would say look at those. I wish I could just, for all these questions, I wish it was a quick 30-second answer. Sometimes it is, but for a lot of these, it's not as simple. All right, Nolan says, thanks for the opportunity to ask a question. If you're diagnosed with Graves' disease, will the TRAB, TSH receptor antibodies, ever return to normal parameters, even if you go into remission? Yeah, I mean, they definitely can, and that's what I aim for. And like I said, you could definitely find more information on my podcast, savemythyroid.com/50 for episode 50, where I talk about lowering antibodies. And then more recently, my 6-part lowering thyroid antibody series on the podcast. So definitely check out those resources. All right. And then Myra says, what is your opinion of Rife frequencies for healing of the thyroid? And she gives some examples like Spooky 2, bioresonance, sapien medicine. Can you discuss, expose, invite these channels and maybe others as well in your next show too? Hoping you will consider elaborating further. Yeah, I mean, the thing about the next show, like I always record my episodes well in advance. So definitely won't be on the next show because my next show has already been recorded. And again, record them in advance. This way, if like something happens, if I lose my voice, for example, or something like that, have a respiratory, or again, something worse, at least I have some episodes in the bank. I mean, I will say I have a history of chronic Lyme disease and Rife. I mean, I'm familiar with frequency therapy. I'm not sure if frequency therapy will heal thyroid directly. I don't think so, but again, I don't want to say 100% no, but some of these frequency devices like Rife frequencies can help with things like Lyme disease and Bartonella. Again, I've had patients who've used Rife. There's another frequency device that I've been using called the Wave 1, WAV1. Just a patient of mine about maybe like a year and a half or 2 years ago told me about it. And I've looked into Rife. It just was one of those things where I'm feeling good. I've been feeling good for years since dealing with Lyme. And I've been a little bit skeptical about Rife and frequency, honestly. And then it's like, if I'm feeling good, how do I know if it's working? So should I spend thousands of dollars on these? Spooky too. I think I've researched that. I think that's pretty reasonable. And so is the Wave 1. And that's why I got it. I'm like, it doesn't make sense for me to spend. I mean, some of these are like $8,000. These other, like, not all of them is Rife machines, but like, do I really want to spend a few $1,000s? And even the Wave 1, I'm not sure if it's doing anything. I'd like to think it is, but it's easy enough to wear, and I just wear it around my arm. And so I find it fascinating. And yeah, I should get someone. I can't say I'm going to get like people from these specific companies. Maybe I'll get the company that I use on the podcast to talk a little bit more about their frequency, or again, someone, a Rife expert, because I'm definitely not a Rife expert, and see also what their thoughts are when it comes to directly affecting thyroid. But I think by affecting these infections, which obviously infections could be potential triggers, that's how it can help with conditions such as Graves and Hashimoto's, and maybe even some non-autoimmune thyroid conditions. All right, so next question, is it possible to still experience Graves symptoms if you still have Graves antibodies, but your thyroid hormones are within normal range? If so, why does this happen? I mean, anything's possible, but so it's funny because I have some people the opposite also, where it's like some people have hyperthyroidism and it's clearly hyper and they're not experiencing hyperthyroidism, even though you figure, hey, they should, and their heart rate might still be okay as well, even though the thyroid hormone levels are elevated. But can someone have normal thyroid hormones and experience Graves symptoms? I mean, again, anything's possible, but I would just probably look elsewhere. I would think, is it really due to the thyroid? If someone's thyroid hormones and TSH are looking good, but more so the thyroid hormones, even if TSH is low, but T3, T4 are within the optimal range and someone's experiencing hyperthyroid symptoms, I would wonder, is there something else going on? Just like, for example, I've spoken about histamine elsewhere. If someone has a histamine intolerance, that can cause tachycardia, like elevated resting heart rate, and other symptoms related to that might seem like it's mimicking hyperthyroidism. But so that's what I would look at. Or infections, like when I dealt with COVID 3 years ago, I felt like I was hyper. I thought maybe I relapsed because I had the big thing was the tachycardia, honestly. It's not like I felt all the symptoms of hyperthyroidism, but the resting heart rate was definitely elevated. But infections can do that. And when I retested thyroid, like a month later, because I didn't want to do it while I was actively dealing with COVID, everything was okay. So anyway, there are other factors that could also produce symptoms that are similar So anyway, to me, I would look elsewhere. So next question from Aubrey. I've had all my thyroid labs tested over the last 13 years, and I perpetually have low T3 levels. I do not have Hashimoto's. I have been on a T3 medicine on and off throughout that time with only a small increase in free T3. The highest my free T3 ever got was 3.6 when my provider doubled the amount of T3 I was taking. My TSH number dropped drastically, and I still had all the hypothyroid symptoms. My liver test all came back in range as well. Any thoughts as to why I either can't convert T4 or can't really use T3 effectively? If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. Thank you for your time. So I spoke a little bit about conversion of T4 to T3. I think it was not here, but part one, someone asked about conversion of T4 to T3. And most of that conversion takes place in the liver, some of it in the gut. High cortisol can be a factor, so adrenals and stress. Inflammation. There's a lot of factors that could affect the T4 to T3 conversion. So again, maybe visit my website, naturalendocrinesolutions.com, and I have some articles on conversion. And then I also have an article on thyroid hormone resistance where the T3 isn't getting into the cell. And again, inflammation can cause that too. Vitamin A is important for the health of the receptor. Zinc is important. So those are some of the things I would look into. Again, I do have some articles, so I would look into those as well. So next question. My adult daughter has Graves. She's on methimazole and wants to get off of it. In addition, sleep deprivation and weight gain are most concerning. Yeah, so again, obviously I can't give recommendations here about getting off methimazole. Patients who are on methimazole and they want to get off, and even them, I don't say stop the methimazole. I usually will put them on Bugleweed, and then as your numbers start going towards the hypo side, the prescribing doctor will reduce the dose of methimazole. And then with sleep deprivation and weight gain, we want to address the cause of the problem. So again, I wish I could just say, do this or take this single supplements, and that will be the solution, but it's not always that easy. So usually we need to find the reason for the sleep deprivation. I mean, the hyperthyroidism can cause sleep deprivation. So a lot of times balancing the thyroid hormones can help, but there could be other factors as well. And weight gain, again, I don't think it was this episode, but the previous one, part one, where I spoke a little bit about some of the factors that could cause weight gain. Because we do see that sometimes with Graves' disease, even though the classic symptom is weight loss, which is what I experienced when I dealt with Graves. A lot of people do experience weight gain. So Marilyn asks, does an uptake scan make a lot of difference in treatment? No, typically it doesn't. So that's why I'm not a big fan of the radioactive iodine uptake scan. And even Dr. Angela Mazza, who I had on the podcast, who's an endocrinologist in Central Florida, she's not a big fan of that either. It usually doesn't make any difference when it comes to treatments. So but read more of the information I have. I could expand on that, but I have some information on the podcast as well as naturalendocrinesolutions.com. All right, next question is from Marilyn. So if your numbers are good with what you're taking, but your antibodies are still high, what should you do? I've read about black cumin seed oil. I mean, black cumin's great. I do have an article and maybe a podcast episode on black cumin, and I do like it, but you want to address remove the triggers, heal the gut. It's not just about taking supplements. So again, savemythyroid.com/50 check out that episode. And then my recent lowering thyroid antibody series, which consists of 6 different episodes on the podcast. All right. So Rachel says, or she asks, how might a breastfeeding mother naturally treat hyperthyroidism when one of the most potent antithyroid herbs, Bugleweed, is contraindicated during lactation? I mean, it's a good question, and that's the challenge with pregnant as well as breastfeeding women. Now, breastfeeding women, according to Kerry Bone, they're able to take motherwort, which can help with the symptoms. But you're right, Bugleweed, he recommends not to take. He says is contraindicated. So there's really nothing, like someone could try to take large amounts of L-carnitine. Again, there's really no research about taking 2,000 to 4,000 milligrams of L-carnitine during breastfeeding. But yeah, I mean, I don't have a great response. I work with pregnant women, but and those who are breastfeeding as well. Actually work with a lot of breastfeeding women. And yeah, it is challenging because a lot of women don't want to take the antithyroid meds breastfeeding or, of course, while pregnant. And it's one of those risk versus benefits factors. And again, I wish I had a great answer like do this or eat a lot of cruciferous vegetables, which I've tried in the past due to their goitrogenic properties, which really don't suppress thyroid hormone, at least not maybe if you take massive amounts of those or eat massive amounts of those foods. But and he also asked, what's your opinion on thyroid castor oil packs for hyperthyroidism? Yeah, I've had Kerry Vitt, who changed her last name, so I always forget her last name now on the podcast. If you do a search for castor oil packs on my website, savemythyroid.com, you'll come across the episode. And yeah, it doesn't seem like it's bad for hyperthyroidism. I think for both hypothyroidism, again, now how beneficial it is, like it's a hot topic, which is why I've had her on the podcast. And I think from a risk versus benefit perspective, the risks are small, but the benefits are also small. It's very popular. And she does recommend putting on a liver first before the thyroid. But I haven't heard anything bad about castor oil packs and hyperthyroidism. All right. So Colette has the next question. So my understanding is that thyroxine will improve TSH, T3, and T4 numbers, but it doesn't help to lower TPO antibodies, therefore not fixing or addressing the cause of the thyroid problem. Is that correct? Thyroxine may reduce some symptoms. Thing is, I only have fatigue, no weight gain, no hair loss, or dry hair and skin. I'm very reluctant to take it if it does not cure my Hashimoto's. I do not like or trust Big Pharma. Yeah, so I mean, you're right. It's definitely not curing Hashimoto's, and it's not addressing the TPO antibodies or thyroglobulin antibodies. So that's where, again, we've had a lot of questions on lowering antibodies. SaveMyThyroid.com/50, my 6-part series on lowering antibodies, thyroid antibodies. I would definitely check out those episodes for more information. You also might want to check out my book, Hashimoto's Triggers. All right, so next question is, they said at the ER that I had subclinical hyperthyroidism. A month later, I had my regular nurse practitioner check to see, but she only tested my TSH and it was 0.41, but I have hand tremors in the night, low ferritin of 8. I have insomnia, yet horrible fatigue. I have mottled skin, anxiety, panic attacks, heat intolerance, lost like 10 pounds in a month, irregular period, restless legs, fast heart and palpitations. But she said it was normal. Should she be running a test on all 3 thyroid tests to actually see? And I would say, yeah, I mean, with Graves, usually the TSH is undetectable, like less than 0.001, for example. So it doesn't sound like you have Graves, but still, I would definitely look at the thyroid hormones, the T3, T4. I would still do the antibodies. I would test reverse T3 in this situation. And I would also try to get a thyroid ultrasound. So yeah, I would just settle for like the TSH, like them looking at the TSH. And then my grandmother has Graves and she had the eye bulging thing years ago, and I don't get it for another month. Oh, you don't see the doctor for another month, but I don't know how to tell her. I know I have it. Don't you think this would be okay? I'm not sure. I mean, if you're having any eye symptoms, not just dryness, but if you're having like bulging of the eyes, eye pressure, then I would agree. Even though your TSH, like most people, Graves, their TSH is undetectable. Everybody's different. So yeah, another reason why you would want to do the antibodies for Graves, and I would do all 3 antibodies for Hashimoto's as well, like the TSI, TPO, thyroglobulin antibodies, full thyroid panel, ultrasound. I would do everything because, yeah, we want to get a full picture. And I mean, of course, I do more than just the blood test. I know you had ferritin, but I would do like vitamin D and B12. And I mean, yeah, I do comprehensive testing. Again, not crazy amount of comprehensive, like blood testing, I'm comprehensive. Functional medicine testing really depends on the person. So I can't say like I don't have everybody. I'm more conservative on the functional medicine testing because it does get expensive. And I want to do what's necessary and not just like have everybody spend like $2,000 on functional medicine test. All right. So Julie has the next question, which I'm not sure of the answer to this, but I still chose it because it was interesting. Why would a thyroid ultrasound trigger a convulsive episode? TSH is elevated and there are thyroid nodules. Biopsies are negative for cancer. Yeah, and I've not heard of that. Again, I've been working with thyroid patients for over 15 years and never heard of anything bad happening with a thyroid ultrasound. And it didn't really, I mean, I got so many questions. I can't say I've researched like things like this. Like it would be interesting to look in the research. I just haven't had time. It's been overwhelming with all the questions that we've had for this, let alone trying to record other episodes for the podcast. But again, I've had patients like for over 15 years, a lot of patients, and I don't recall any of them saying that they had a convulsive attack by getting the thyroid ultrasound. So I am honestly not sure, Julie. All right. So Teresa with the next question. I have had Graves since 2017 and went into remission. I was also admitted to the hospital in 2017 with a thyroid storm and will never forget that feeling. I went through menopause and some traumatic events for the past 10 years. And 6 months ago, I received a pellet injection for hormone replacement. I don't know if it's a coincidence or not. Can hormone replacement cause hyperthyroidism? I feel some of the symptoms are back, but my test results come out normal. I am supposed to get more HRT at the end of April, but I'm nervous because I don't know if they can mess up my thyroid. Have you ever heard anything about that? I mean, hormone imbalances could definitely affect the thyroid, but HRT, hormone replacement therapy, usually is not going to be a trigger. And you mentioned your test results came back normal. So like if your TSH, T3, T4 are looking good, then that would suggest you don't have hyperthyroidism, but maybe the hormone replacement therapy is still causing some symptoms like palpitations, for example. Like, if your hormones are like too little or too much hormone, like estrogen, for example, and can cause palpitations, which might make someone think that they have hyperthyroidism. So if you're taking too much of the HRT, which I don't know if that's the case, but I can understand being nervous. But yeah, usually it's not going to like trigger hyperthyroidism Graves. And especially if you did a thyroid panel and everything's looking good, then I'm thinking, well, again, maybe it is related to the HRT, but not necessarily the HRT causing hyperthyroidism. Could also be coincidental as well. That's a possibility too. But yeah, it is possible that if the dosing's not right, which sometimes it could be challenging. So I understand if they need to make adjustments to that, but that might be responsible for the symptoms. All right. So Ronnie asked a question. What do you consider optimal free T3 and reverse T3? And do you believe that testing TSH has much value for Hashimoto's patients? I mean, I do like TSH definitely is not the most important value, not the most important marker, but I do like to see it. So yeah, I think it does have value. If someone has a TSH of 3, because again, sometimes the thyroid hormones look good, but the TSH doesn't. If someone has a TSH of 4, which is within most lab ranges, but the T3, T4, maybe even reverse T3 looks good, again, we wouldn't know by looking at the other markers. So I mean, yeah, I recommend looking at everything, but I definitely don't believe that TSH alone has much value. So I think you need to look beyond TSH, but I do believe it should be included. And I mentioned, again, I forgot if it was this episode or the previous one, free T3, United States. Again, I don't know, like there's different ranges, but between 3 and 3.5. Reverse T3, I like 15 or below. Some like to see it lower. Like if they see 15, they'll think it's too high. I like to see it 10 to 12 or below 10. But I'm not too concerned if someone has a reverse T3 of, let's say, 15, for example. I mean, especially if everything else looks good. So next question, is there a possibility of fully reversing subclinical hyperthyroidism with nodules, or is it always going to be there? And is it just a management type solution? There doesn't seem to be much information on this topic, as Graves seems to always be the main topic of hyperthyroidism. Yeah, I mean, a lot of people do have subclinical hyperthyroidism, and a lot of people have nodules. And so I did speak about nodules early in part one of this Q&A, your thyroid questions answered. So yeah, it is possible to address the nodules, to reverse the subclinical hyperthyroidism. Again, not saying it's a quick and easy process, but definitely is possible. Okay, so Lindsay with the next question. So this may have been covered in your episode about lab values that you've referenced before, but I haven't been able to find it scrolling through my podcast app. So what values will you see improve first in your labs? How much variation is normal between tests with T3 and T4? I had free T3, free T4, TPO drawn by two different doctors 2 days apart. There were differences in my numbers. Free T3 was 6, then 2 days later it was 3.8. T4 was 2.2, then 1.37. TPO went from 79.1 to 115.9. During this time, I did not take any medication. My endocrinologist did repeat labs at the 3-month mark, but only free T3, free T4, and TSH. T3 went up to 4, T4 to 1.83. Does this mean that the Bugleweed I've been taking has not been working? How do you know if it's working outside of your labs? Yeah, so a number of questions here. I mean, usually we'll see the thyroid hormones decrease first and TSH next. Not TSH last. TSH usually takes a while to decrease. So antibodies usually you'll see decrease before TSH increases. And yeah, I mean, there could be differences, and that's why also you want to try to stick with the same lab. But even so, you would think, hey, like some labs are more accurate than others. And unfortunately, it does come down to the experience of the technicians, which I've learned a number of years ago. So if you get your labs tested at a lab or even multiple labs, and you have good technicians, then it should be pretty consistent. Now it might vary a little bit, but yeah, like that's a big fluctuation. Like free T3 is 6, and then 2 days later, 3.8. I mean, the 6 is definitely elevated, whereas 3.8 is within the lab range of many labs, maybe on the higher side. But same thing for T4, free T4 2.2 is elevated. 1.37 is actually within optimal range. So I've had other people do that. Usually it's pretty close. Usually it's not that big of a difference. So they might do it at one lab, it's 1.37, and then they do it at another lab and it's like 1.54, which is still a difference, but not a huge difference. The antibodies, especially TPO and thyroglobulin, can roller coaster a little bit. And that's why even if someone does 2 labs like a few months apart and they're a big, like, again, it's really long-term looking at the pattern and seeing them head in the right direction. But yeah, like that isn't honestly too surprising. And then as far as the Bugleweed, yeah, I mean, if the numbers increased, and Bugleweed might have not been working, but also could be that the potency, like when I dealt with Graves, I was taking a 1 to 2 extract. Some people take like a 1 to 5 extract, which isn't as potent. And then every brand is different. And then as far as how do you know if it's working outside of your labs? I mean, sometimes it's challenging. When I dealt with Graves' disease, I knew it was working because it was helping, like the Bugleweed was helping with the resting heart rate. So I definitely knew it was helping even before I did the blood test, but not everybody has this experience. So this says, I have hyperthyroidism for 9 years and I don't take anything because I won't take any kind of medicine. I don't do medication. My doctor said last time I saw her that everything looked okay, but she thinks I'll never fix the thyroid. I believe there's a natural way without pills and harsh chemicals. I believe in what God put here for our body, what I can use that has no side effects for the thyroid. So just the comments. I mean, there is a time and place for medication. I understand some people, I avoided the medication. So some people think I'm anti-med, but, and we'll talk more about hyperthyroidism. Like for those who are on thyroid hormone replacements, again, I don't look at it as a medication. I think of it more as a replacements, thyroid hormone replacement, not a medication. But yeah, there is a time and place for medication. And but yeah, I can understand really trying to do everything you can to avoid it. All right. So next question. I've been taking levothyroxine for many years, but would love, if possible, to heal my thyroid to the point of being able to discontinue the medication. It's the only prescription medication I take. My range over the years has been 0.1, 0.85, and 0.75. I assume this is the TSH, depending on every 6-month lab draws. I'm very health conscious, exercise regularly, grow most of my food naturally without chemicals of any kind. Hope you can guide me to heal my thyroid. Also take supplemental L-tyrosine and selenium. Thanks in advance for your guidance. So again, another example where there's only so much I could do with like in this Q&A episode. It's really like there's only so much as far as guidance I could give. But the good news, I have episodes and even my book, Hashimoto's Triggers. So the question is, have you had the antibodies tested? Because most people with hypothyroidism have Hashimoto's, which is more of an immune system condition. And it's great that you're eating well and then growing your food naturally, exercising regularly, but finding triggers, removing triggers, healing the gut. Sounds like you might need to dig deeper. Again, I'm not saying everybody could heal their, like be off of the levothyroxine or whatever they're taking, desiccated thyroid. But I think it's a good goal, but you really want to do everything to optimize your immune system health. Also keep in mind, in the case of hypothyroidism, underactive thyroid, there's a lot of endocrine disrupting chemicals that directly affect the thyroid, like for example, microplastics, xenoestrogens. So trying to do everything you can to minimize that exposure. So if someone's on thyroid hormone replacement and they're drinking water out of plastic bottles every day, and their goal is to get off the thyroid hormone, that's like one of the first things I would say. Well, why don't you stop drinking water out of plastic bottles? Because the plastic disrupts the thyroid gland, also affects the immune system as well, also affects the gut microbiome. But yeah, you might want to check out Hashimoto's Triggers. Just again, the most comprehensive book on Hashimoto's. Again, I'm not sure if you have Hashimoto's, but I still think a lot of that information will benefit even those with the non-autoimmune thyroid condition. So next question, can Bugleweed be taken while I'm still on Tapazole or PTU? So pretty much while on antithyroid medication, with the idea being that I would gradually taper off the medication so my thyroid would stable in a normal range with Bugleweed only. Again, I can't give you specific recommendations, but I do this with patients. I do have, it's not everybody, some patients, they're just on the medication. Some people like myself, when I dealt with Graves, I just took the Bugleweed. But if someone's on antithyroid medication, they really feel strongly about not being on it, they might take the Bugleweed, remain on the antithyroid medication, and then as the numbers start creeping towards the hypothyroid side, they then might gradually decrease, or not them, but the prescribing doctor decrease the in this case, the Tapazole or the PTU or whatever antithyroid medication they're taking. All right, so Glenna says, I'm going to throw this question back out again. The last question session, so a few months ago, was can I take my thyroid hormone, Nature Thyroid, with lemon water to get the lemon water first thing in the morning benefit? Like, is it going to interfere with thyroid hormone? Because some things will. Dr. Isabella Wentz, she's like the Hashimoto's expert, also thyroid hormone. So she's really knowledgeable. And she actually says that drinking like putting lemon in water, which essentially is lemon water, just like squeezing lemon in water, can actually, I think she said that it could actually help with absorption, but it seems like it's not going to inhibit, if anything. So she seems to be a fan of lemon water and thinks it's fine with taking thyroid hormone. And then a new question, is it okay to take thyroid hormone with hydrogen water? So I don't know anything negative about hydrogen water and thyroid hormone. There's probably nothing in the research about that, because again, there's not a lot of research with hydrogen water, but I'd be surprised if the hydrogen water inhibits thyroid hormone. All right, so do GLP-1 medications like semaglutide affect people with Graves? I started one due to my weight and I haven't found anything negative, but I thought I would ask. Haven't seen anything in the research. I have done some research on this. Haven't seen anything negative about the GLP-1 meds and affecting people with Graves or Hashimoto's, like especially that like autoimmune response. So yeah, I can't specifically say it's perfectly fine to take, but yeah, that I have not seen anything so far in the research. Something could come out this year, next year, but yeah, so far I haven't seen anything negative. And yeah, this is like a piece of another question. Can you take T3 by itself? Does it need a prescription? I mean, some people have success taking T3 by itself, and it does need a prescription. I mean, there are companies like GTA Forte from Biotics Research is like a glandular and it has some T3 in there, then that actually doesn't need a prescription. So, but if someone's taking something like Cytomel, that would need to be via prescription. And yeah, but you also ideally want to try to figure out, like, if someone has normal T4, low T3, what's affecting that conversion of T4 to T3, which is what I mentioned again, I think it was part 1 of this episode. All right, so that's my responses to many of the questions submitted for this edition of Your Thyroid Questions Answered. Again, I apologize if I didn't get to your question. There was, other great questions. Some of them were, even though some of the ones I covered was still a little bit long, but again, some of them were like really long. And then, like I said, it's just trying not to make these episodes like 2 hours long. Which it would have been if I had a single episode, and I could have had like a 3 or 4 part episode. But I try just to, I just try to have no more than like 2 parts for these Q&As. But I do answer questions elsewhere. Sometimes I do Facebook Lives. Sometimes I'll do 5-day challenges, boot camps. Sometimes those are free. Many other times lower cost where I'll answer questions. Of course, I'll do another one of these in a few months as well. So if you have questions for me to answer in a future episode, send them to info@naturalendocrinesolutions.com. Thanks again for tuning in, and I look forward to catching you in the next episode.